trying to rehab at home and it's not working, or you're frustrated with trying to do these same exercises over and over again without any results? Well, today we're going to talk about the 3 things that you need to know to build your own rehab protocol at home, okay? The 3 things are what, when, and how. What does progression look like? How do we progress? And most importantly, when do we progress? These are the 3 things that we're going to be answering in this video today. Progression is when we go from one stage to the next. So that may be our starting point is we can't get our arm up all the way because tight muscles, adhesions, whatever it may be, we can't get our arm in that full range of motion. Okay, we can't fight gravity enough to get it up there all the way. So progression at first would be range of motion. Okay, we progress from not being able to do a full range of motion to full range of motion. The next step after that may be pain-free range of motion, where we can do that full range of motion pain-free. Okay, once we restore range of motion, then we're going to start working on strengthening and stabilizing. Okay, that's how we progress through, with the end goal, right? The end of the progression being full functioning without pain. Okay, that is our ideal progression, what it is. Now we know what progression is, we need to talk about how to progress. Okay, how do we go from no range of motion to strong, being able to lift weight up over our heads, right? When we're talking about this, we have 3 variables that we look at. One is volume, the next one is intensity, and frequency. Okay, so we're going to look at those 3 variables as we do our program. So again, looking back to the shoulder. Say I'm through the range of motion, I have pain-free range of motion, unless I'm loaded, unless I have some weight, then that hurts a little bit and I feel weak. I'm going to manipulate those 3 variables, right? Frequency, volume, and intensity, to get to the point I want. So first, maybe if I'm using banded exercises, I have the lightest band. I have a yellow band here, and I'm going to work on strengthening this way. I do 3 sets, 10 reps. I do this 3 days a week, right? So our 3 days a week is the frequency, our volume is the 10 reps for 3 sets, and our intensity is the yellow colored band, is the resistance that we have. So if I want to increase or I want to progress, I'm going to have to manipulate those 3. So then maybe I upgrade to the red band, right, for more weight, or I increase to 15 reps and 3 sets, or I increase it to 5 days a week instead of 3. So this is how we are going to progress our treatment rehab program. Okay, we know what progression is, we know how to progress with those 3 variables, and the next one is when to progress. This is a little bit more subjective. It's hard to have anything empirical, right, that can tell us when to progress, but it's about how you feel, how your body feels when doing the stage you're on. So set goals. That's the biggest thing, is to when to progress. If you can, going back to our same example, right, if you're starting at the yellow band and you're feeling good, you can do 10 reps, then it's time to do the next step and progress, right? So we're going to progress into just a heavier weight with that red band. We're going to progress that way. That's pretty easy. Then the next step may be a more complicated movement pattern, right? Instead of coming straight up, we're coming across and out. So we're introducing more planes of movement. So that can be our cue, is you just feel good at the weight that you're doing now. It can be the best sign for when to progress.